Hello, everybody. Welcome back to Maternity Monday. I'm Dr. Daly, and I am here with Dr. Valerie. And today we're going to be talking about one of the main reasons parents bring their kids to us, and that is ear infections. Let me ask you quick questions, mamas. How often do you go to the pediatrician and just to be told there is another ear infection? So we are going to be unpacking today why this keeps happening, the real cause behind it, and what actually works, what alternatives will work for ear infections at long term.
Yes, and then the usual prescription, it's antibiotics and it's handed out like candy. But here is something most parents don't know. In 2002, the American Academy of Pediatricians reported that ear infections are not only the most commonly diagnosed condition in children, but also one of the most misdiagnosed. So, what is really going on with this?
Yeah. So a middle ear infection or otitis media usually will start when the Eustachian tube, which is a very small channel connecting the middle ear to the back of your throat, that will get inflamed and blocked. So that blockage will prevent the fluid from draining properly. And that fluid will be building up, and that's what is going to cause the pressure, the pain, and sometimes an ear infection in your kids.
But here is a common misconception. It is not always bacteria what cause the ear infection. In fact, that inflammation can happen because your kid had a cold, a sore throat, it's teething, allergies, reflux, even viruses. So 70% of ear infections are viral, which mean antibiotics will not help.
Exactly. And those symptoms that your child will present with, like fever, pulling the ear, sleep issues, crankiness, all of those are just signs, just your children, your child is just telling you that something is off in their body. And the kids are more prone to them because their eustachian tube is shorter, narrower, and it lies more horizontal than adults. And that is what make it easier for the fluid to get trapped in there and harder for it to drain.
Other thing, before I continue talking, other thing that I notice a lot that parents told me that their kids do, it's also like hitting their head on the side, close to the ear, not just the pulling, but also like hitting them. And usually that's a sign that the ears is bothered. Some other triggers that increase the risk are bottle feeding while laying down, secondhand smoke exposure, environmental toxins, and food sensitivity, and poor gut health. So diagnosis usually involve an otoscope. So the otoscope is a tool that doctor use to put some light inside the ear to be able to see them. But some studies show that misdiagnosis can happen in up to 30% of the cases.
Yeah, a lot. So even when an ear infection is bacterial, studies have shown that most will resolve on their own over 48 to 72 hours. But antibiotics are often very prescribed, and they do not help if it's viral. And the antibiotic can disrupt your child's gut microbiome, and it will increase a risk of antibiotic resistance as well. And repeated antibiotic use is linked to gut dysbiosis, allergies, and even immune challenges later on in their lives.
Then there is a surgical route. Um, those are the famous ear tubes. So it is a common fix, but often just that, a band-aid, not a solution. It drains the fluid, but does not address why the fluid is stuck in the first place. There is a lot of cases that they do the ear tubes and the kids still having a lot of ear infection or a lot of ear pain and did not resolve the problem at all.
Yeah, and often what they do is just, oh, let's redo the tubes and redo the tubes. And that's not really going to the root cause of
Yep.
the issue. So that's where we come in. Chiropractic care, we do not treat anything. We're not treating the infection. So we are just looking at your nervous system that is working properly and that your nervous system has no interference, especially in the top of your neck, that atlas, the first bone. And when that bone is misaligned, that can put pressure on those tachyon tubes, and that will affect the lymphatic drainage and immune response. So the adjustments will help with what things, Valerie?
So chiropractic adjustment can help to improve the station to function, reduce the inflammation and the pressure, and support better immune regulation. Parents often report better sleep, less fluids built up, and fewer recurrences. One study published in the Journal of Clinical Chiropractic Pediatric found that 93% of children in the study experienced improvement or resolution of symptoms after chiropractic care. I also want to mention that um, in my experience, since I was a kid, I had recurring ear problems and ear pain all my life. My mom went with me to many, many different doctors, and I still have the same problem until I was an adult and I found out chiropractic care. And right now, I get adjusted. Usually, the first vertebra, as Dr. Daly mentioned, the atlas, and it helped me with my ear pains that I have been suffering for many years, and that resolved my problem. And I can say, as an adult, every time because it still happened, that my ears start bothered or I have pressure pain, the adjustment usually resolve all my problems. And I visit ENT in the past for this problem, and they look at it and they say everything is okay, but let's just do antibiotics to see if that resolves the problem. I never do the antibiotics because I know that's not my problem, and if there is not an infection, I will not do it. But I just want to let everybody know about my experience. That's something that have been helping me a lot, and still as an adult, not as a kid, it's still helping me. So if you're an adult and you have problem with your ears, this is not just for kids, also for adults.
Hmm. Yeah, definitely. And because sometimes when you are a kid and you never got that resolved as an adult, you're keep having it, right? If you don't got to the root cause of what's causing it, as an adult, you're gonna keep having those. So as a recap, ear infections are common, but not always what they seem. So you do not always need antibiotics. And there are holistic approaches that will look at why the body is struggling in the first place.
So ask question, track your symptoms, look at the whole child, partner with your providers who want to get to the root and not just cover up the symptoms.
Yes, please. Let's always get to
Yeah.
the root causes of everything
And
before
always
covering and band-aid and all of those things.
yeah, and always ask question to your doctor because as I mentioned before, it's like I was recommended to use antibiotic just in case. But it's like that will cause other problems. So you can ask your provider, why do I have a bacterial infection? No, what are my other options? And ask questions to know what is the root of the problem on yourself.
Yes. So thank you so much, everyone, for joining us today for another episode of Maternity Monday. And if you have any questions about this or anything else, just let us know. Comment below, and we will love to answer your questions. And if you find this helpful, just please like it, share it with another mama, and make sure to follow us on Instagram. And we'll see you next Monday.
See you next Monday.